University Hospital's Case Medical Center is a tertiary care academic medical center in Cleveland, Ohio.
We basically provide all levels of care, from outpatient surgery to trauma patients in our pediatric area.
We had been looking for a replacement for a current operating room scheduling system and nursing documentation system. Our main interest was to really find a system that would allow us to kind of follow the patient, a surgical patient, from the preoperative world through the ICU.
UH decided to really, automate all of the workflow.
We looked at different systems and compared and contrasted, and then selected Picis.
When they first started at the main facility with implementing OR Manager, from that time it's grown into capturing documentation for the complete continuum of perioperative care.
We're able to cover the patient from beginning to end.
We also utilize the perioperative nursing data set that's embedded within Picis to develop an individualized plan of care for each patient as they come through the OR.
Within the clinical setting, Picis has allowed us to improve our charting, our capture. All our equipment automatically feeds the data into the system. It basically frees up the hands of the clinician, so you're not writing or trying to capture vital signs that are changing rapidly, especially in critically ill patients.
On a daily basis, a lot of what we do as managers in the OR relies upon the information that we can get, and using Picis makes it easier to get to that information.
As a clinician, I find that using the Picis application in the operating room allows me to have a better charting system. It's extremely important as clinical providers to be able to pull up previous records or other information that's been documented on the patient. Now we can see that in the operative setting when necessary.
Obviously, you want the data to be captured once and then repeated to the downstream systems. If you've got an application that just naturally flows, from one module to another, that's certainly a lot more appealing.
Prior to this, it was a lot of hand data collection, or took a lot of time to try to generate reports, and it's much more accessible now.
You understand that the data is already there behind you, so you can really focus on the patient care as a clinician.
So one of the key strengths of the Picis solution is the analytics.
In Anesthesia Manager as well as OR Manager, there are SmartTrack fields, and we have been able to use these SmartTrack screens to improve our efficiencies in the OR. We have actually been able to improve our turnover times based on those efficiencies.
We can pretty much ask a question and pull the information up as we sit there. So we can do that as we have our meetings and really use that information in real time to make decisions. We've been very pleased over the last 6 or 7 years to find that we're at a point now where we're actually deriving benefit from the system to improve our own care.
We've been able to change practices. We've been able to improve practices and documentation. So this is all relating to better quality care for the patients.
And now we're in the phase where it's kind of fun because we can actually use it to help improve the quality and the efficiency of our care.